Hi, I'm Jack Blannett. I'm a cardiologist. I've been in practice as an adult cardiologist for 30 years. When I started, 95% of cardiologists were private. Now that's approaching closer to 50-50. So the way people practice is changing. 30 years ago, somebody came in with a heart attack. We put them at bed rest. We put them on a very strong blood thinner. They couldn't do anything. Somebody comes to us with a heart attack now. If it's an acute heart attack, we get them directly to the cath lab. We put a catheter in their groin. We blow up a balloon, put a stent in. We send them home 2 days later. We have our own open heart program. We have our own electrophysiology program. We do pacemakers. We do defibrillators. We do the surgery here. Heart disease is, along with cancer, the 1 in 2 killers. So if God gives us years, God's also going to give us both of those. And the idea of going after lipids early is that we can prolong those cardiac events. So what we've done here, and many hospitals are doing it, is if someone presents with a stroke or someone presents with coronary disease, after that's taken care of, other vascular areas are looked at. And that's what we call secondary prevention. It's an even stronger influence if you can work at primary prevention. So what your mama used to tell you about eating right and exercising, and I'd put a plea in for anyone who's looking at this to get the kids off the computer and off the cell phones, to stop the tweeting, pagers, texting, etc., and get them outside and get them exercising. The patients who come in to see me now are much better informed. They read, they go online, they go to WebMD. They're buying into their health care because they have information. I grew up in upstate Pennsylvania. My mom was a nurse. I have 2 brothers who were nurse anesthetists. I have 3 brothers total. They are all married to nurses. The 4th brother is an electrician, and I'm the only doctor. I love the beach. I could spend 3 days a week on a golf course. I like to scuba dive, and I love spending time with my grandchildren, but more than spending time with them, I love spoiling them. My mentors took me to the bedside. We sat on the bed, we touched the patient, and we established a relationship. I still do it. And I do wash hands, and I will wear gloves, but I need to contact the patient. What keeps me in practice is the ability to form a relationship with a patient, make a partnership. Patients who do well because of what they do, not just because of what we do. So if you come here, most people will try to establish that with you. But you will have expectations that you have to live up to too.